So our abstract mainly focused on the fact that we needed to treat patients for the cytokine release syndrome in the presence of a national shortage of Tocilizumab. And with that, we needed to adapt because in general, when you're treating patients with CAR T cells, you need to store 2 doses of Tocilizumab per patient treated. So we really didn't want to run out of Tocilizumab while being able to continue to treating patients with CAR Ts and in case they develop CRS. Cytokine release syndrome is an inflammatory syndrome that usually has, at least in part, is mediated by interleukin-6. So we used another inhibitor, which is an antibody to interleukin-6 instead of the interleukin-6 receptor, which is called Siltuximab. Primarily what we did is we would use Siltuximab as first line of defense for patients who develop cytokine release syndrome, holding the Tocilizumab in case they continue to present cytokine release syndrome if they didn't respond to Siltuximab. We observed we compared the 40 patients that we treated with this algorithm of Siltuximab first treatment of CRS, and we compared them with 95 patients that we have previously treated with a Tocilizumab first or Tocilizumab only strategy. And what we observed is that approximately half of the patients developed cytokine release syndrome in both groups, and the difference was not statistically significant, although we saw a little bit more severe cytokine release syndrome in the Tocilizumab first group, but that's probably because the patients that were treated were those that were treated in the first stages of introduction of CAR T cells, so the experience with CRS was lower, and we tended to have patients with more advanced CRS. However, we didn't observe statistically significant differences in the incidence of severe CRS and the incidence of needing 2 or more doses, which is approximately 20% of the cases in both groups. So what is important is that while Tocilizumab is the standard of care for cytokine release syndrome, it adds, at least from clinical experience and on a retrospective basis, it adds some evidence from these data that you can use Siltuximab to treat cytokine release syndrome before you need Tocilizumab. It helps you spare it, and it also helps you, add additional options for treatment of this complication of CAR T cells.